Hello, all. I am just quickly bringing to you a very short update on our Wellbeing Council work so far this year. I'm going to try to keep it short and sweet, recognizing that I don't know whether or not Catherine will be able to join our call, but it's possible that she may hop on and have additional opportunities to discuss with you, but I just want to give you a high-level overview of the work we've done so far this year. In February, we had two presenters. Rich Zafir came and presented to us regarding his new book that came out earlier 2023 called A Cure for the Common Company. He looks a lot at just the leadership frameworks and the role of leadership in developing well-being in their team members, including, he lays out 6 different pillars that he considers to be essential to the well-being of their staff. And his book was really inspired by the fact that the average person spends about 2,000 hours or more working a year, but when they see a physician like him, they typically only spend about 15 minutes with that physician. And he recognized that well-being culture really needs more attention in the workplace, because in order for us to be well, we need to cultivate these feelings of connections to our community and not feeling isolated from others, meaningful relationships. And ensure that we're getting support from leaders who have been trained to understand how to support well-being in their workforce. So really interesting work that he's doing. Catherine Meese also presented to us in February on the early results of an accountable care team intervention. So ACT is what we were calling it for short. There were multiple parts of this. It's a really comprehensive, time-intensive program. It started with an 11 to 16 week training where they train leadership triads in like interprofessional ACT problem solving. They put a lot of effort into this, and it has kind of multiple different layers. They've been collecting data since at least 2020, but they've had multiple cohorts now, and this is considered to be a longer term intervention and study. So it will be changed and additional information will be available as they go. Essentially what they're trying to do is flatten the hierarchy on their teams and create just kind of more interprofessional opportunities to interact with one another and grow their teams. And so in 2020, the initial data showed that there was a statistical difference in the well-being measures of the ACT teams versus the control teams. There was a higher sense of community, lower scores of loneliness. There was higher levels of resilience. But there were also some mixed results in terms of there's a lot of additional time intensivity, as well as additional work that's put on the plate of these ACT teams that are actually negatively impacting their well-being. So although there were positive correlations, there were also negative correlations. And so the results were promising, especially given that now they can take this data and reevaluate. One of the things that they were most able to identify was that it's important to ensure that the individuals on these teams have the time to be engaging in what they're being asked to do, like these leadership trainings, cohorting, systems thinking, curriculum training, interprofessional ACT team problem solving meetings, daily interprofessional rounds. There's a lot that they're being asked to do. And so if we're not taking some things off of their plates in order to make time to prioritize this intervention, to see if it can have just a positive impact on their well-being, then those results are going to be mixed in terms of potentially having negative as well. In April, we had 2 additional presentations. Dexter Barrowman of Maui Health came. She presented a really, really comprehensive overview of a well-being initiative that they've been able to implement, focused primarily on these shared cultural norms of their community. Hawaii has a very distinctive culture. It's developed differently than other parts of the world. They're very proud of this. It's integrated into their lifestyle and everything they know. And in order for them to have success with the full-scale implementation, she walked us through step by step, like what they did to engage stakeholders, how they implemented it, how they measured it, how they were able to drive this system-wide change, and the importance of that leadership buy-in and support, but also of prioritizing and knowing the culture of your organization and the culture of your greater community in order to do so. Our second presentation in April was by Corey Feist, who joined us representing the Dr. Lorna Breen Heroes Foundation. He and his family have been personally impacted by the loss of a family member to suicide who was a physician during the COVID pandemic. And he spoke to the advocacy work that they're engaged in to prevent physician suicide, reduce the barriers to mental health support for clinical staff, and minimize the unnecessary bureaucratical tasks that are placed on doctors in the workplace. They have identified 3 drivers of suicide as being stigma, lack of access to care, and job stressors, as well as started to look at how they can eliminate the systemic barriers to accessing care in the first place. And so one of those things that they're doing is advocating at a state and federal level for changes to laws that would prevent physicians from getting mental health care or accessing it because of fear of losing licensure or other potential consequences associated with that for them in their profession. And so the work they're doing is really interesting and meaningful. We had another really interesting person join us in June, Remy Malouf, who represented Bellevue Medical Center all the way in Lebanon. And she was able to share a really powerful video that was detailing what was or is thought to be the 3rd largest explosion recorded in the world that happened in Lebanon in 2019, and how Remy's staff and leaders at Bellevue Medical Center have been able to persevere through the economic challenges following that, the destabilization of just like the countries surrounding them, the challenges of the COVID-19 pandemic, a major economic recession, and additional challenges there as well. She focused primarily on this idea of shared organizational values and the importance of staff support structures and leadership engagement as being primary drivers of well-being, and detailed the specific steps they've taken, which have led to a 90% patient satisfaction rate, 90% physician satisfaction rate, a 70% staff satisfaction rate, as well as increased retention of their team members, because retention is an issue everywhere right now, I think, not just in the US, but at least in Lebanon, we have that in common. We also, in June, had a presentation from our members from Cone Health, Shannon Sandiford and Kate Watts. They talked about their healthy food and beverage initiative. It's been expanding over the last few years. They've partnered with Sodexo, who is their food and beverage vendor, to develop opportunities in identifying healthy items, changing around what's available in their cafes and food cafeterias, and educating staff about their eating choices. So they've really, and they've also, which I thought was really cool, started bringing a farmer's market on site. They've offered employee discounts to healthy meal services like Thrive Market or HelloFresh or Green Chef. And now they're focusing a lot on the primary prevention through healthy eating. So they're educating a lot on how food choices impact us and what different elements of nutrition are. They do this through really accessible resources, marketing throughout the hospital, clearly available on their website and their intranet internally. They also said that some of their best practices for success have included ensuring that they have a multidisciplinary team across their network of team members, and that they have really strong leadership buy-in to be able to continue to invest in the process. And so I'm looking forward to hearing more about the work that Cone is doing in this space as well to advance opportunities for increased knowledge around nutrition and well-being and what the long-term outcomes are for their team members. Our next meeting is in August. We have a few additional presentations coming in from on both our members' advocacy and their individual well-being initiatives. So I'm looking forward to that. We're also starting the work of a well-being work group that is focused primarily on identifying kind of some of the best practices related to promoting well-being in the workforce, and essentially guiding or providing an implementation guide that others can follow to ensure they're implementing best practices when considering their well-being initiatives. This may end up looking like case studies from our member organizations of what they've tried that's been successful and what they've tried that hasn't, and how they've learned from both the positive and negative experiences, or successful and challenging experiences that they've had in this space. I look forward to answering any questions you may have. I'm sorry if I was a little long-winded, but I wanted to keep it as short as possible. And I will also make sure that I am sending over the links should you be interested in watching any of our council calls. I hope you have a beautiful day. Please reach out with any questions, and I will see you in August.